I just got the notification that it's being live streamed.
Mine says it's still loading. I don't know. There we go. I think we're good. I'm seeing it on my second screen now, so hopefully we're good.
That was a little weird, but I just pulled it up on YouTube and it is there. So smile, everybody.
I always try to pull it up on a separate screen on YouTube so I can keep an eye on it throughout. And that way, if it does stop for some reason, I might notice it better. It's a trick I learned the hard way when it didn't work one time and in the middle of everything and I didn't know it. Good morning, everyone joining in.
Good morning, everybody who's joining. We'll get started in just a minute. Debbie, I'll celebrate that we're officially at a quorum. Go team. Thank you, everybody. We appreciate it.
Nobody can leave to use the restroom or anything until after the vote.
Terrific. Well, good morning, everybody. This is Amanda Peterson, and I'm so glad to welcome you all to our March Early Childhood Recommendations panel meeting. I hope that you all are staying safe and warm. I hope that you all are excited for spring break next week. And I appreciate all of you for being here today as we continue to move our work forward. So today we anticipate that we'll have a slightly shorter than normal meeting. And Debbie has sent out the agenda in advance. It would probably be helpful for me if I started sharing my screen with the information from today, but I was having too much fun chatting about everything. Did I share my screen successfully? Awesome. So thanks to all of you for being here. As you all know, this is a remote meeting, which means that we'll clearly identify ourselves when we start talking. We are successfully being live streamed on YouTube, and there's closed captioning available there. We will not be using the chat feature to communicate with each other, since that's not available on YouTube. And when we make motions and when we vote, we will clearly state that. And I will clearly announce the results of that so that folks who are following along know the results. And as a reminder, when we're having discussion in the big group, it's not essential, but it is helpful to use the raise hand feature when you've got something to say so that we can make sure that everybody gets a chance to talk. So today we will have our regular beginning of meeting business, and then we will discuss the work that we've been doing over the past several months on the two recommendations that have been developed by work groups that we will be bringing to, that we, if approved today, will be bringing to the Children's Cabinet Board when they meet on April 1st. And then Debbie will discuss our work ahead. We will then split out into breakout sessions, and then we'll come back together to report out And then we will plan to adjourn probably around 10:30 a.m. So I would appreciate if somebody would make a motion to approve today's agenda.
This is Reva Wattis. I will make that motion to approve.
Thank you, Reva. And would somebody like to second that?
This is Cornelia Stevens. I second.
Thank you, Cornelia. Everybody, you can either give me a 3D thumbs up or an emoji thumbs up. Terrific. Is anybody opposed? That motion passes unanimously. And then next, Debbie sent out the draft. Oh, sorry, Lisa. Was that a thumbs up or a hand? Oh, okay. That was a thumbs up. Good deal. And then Debbie sent out the draft minutes from our February 18th meeting. Did we have any recommended adjustments to those minutes? Not seeing any. Would somebody like to make a motion to approve those minutes?
This is Maritas. I make a motion to approve the minutes.
Thank you, Maritas. Would somebody like to second that?
This is Amy Meek and I second.
Thank you, Amy. All right, everybody, same sign, either a 3D thumbs up or an emoji thumbs up to approve those minutes. Thank you, everybody. Is anybody opposed? That also passes unanimously. Debbie, did we have anybody who signed up to share open comments during today's Kansas Open Forum portion of the meeting?
We did not.
All right, then we will move into our discussion. So Debbie sent out our draft recommendations. Again, thanks to all of you for your hard work to develop these recommendations and then also for taking the time to review them. If you are looking in your email inbox to pull them up, I'll share them on my screen in just a minute, but Debbie sent these out on March 7th at 1:53 p.m. So if you are looking around in your inbox, that's where you can find them. But I will start with the childcare recruitment and retention recommendation. And are you able to see that on the screen or is it still on the PowerPoint? You got it? Okay. I will not read this word for word for everybody since it's here, but I wanted to make sure that we had this up so that the folks who were watching along online would be able to see it. And this recommendation really highlights well, I will read it. The recommendation is that the Kansas Children's Cabinet, in its role as the Early Childhood Advisory Council, recommends state agencies and contracted partners utilize federal relief funding to design and implement a plan to issue one-time bonus payments to help retain individual childcare professionals in licensed childcare settings. I'll highlight that there was a minor change made. Thanks for the feedback to change childcare providers to childcare professionals in the wording in this recommendation. And it shares it then, as all of our recommendations do, shares the background information to develop this. So it makes a connection back to the All In for Kansas Kids strategic plan. And it also highlights the national resources and findings of the needs assessments, as well as the feedback that we've received from childcare professionals that helped inform this plan, or this recommendation, I should say. As ours do, it highlights the background for the other organizations that have a role in this work. And it also describes why this recommendation is important for Kansas's early childhood care and education system. I'll highlight that something that I especially appreciate about the work that this work group did is that they really showed their homework and showed their work in terms of the resources that were linked in the appendix. And so we see that it highlights the federal Dear Colleague letter that was sent out to states. And it also highlights other states that have engaged in this strategy and shares some of the background of their work. The recommendation also describes who is impacted by this issue, as with many things. When we remember that we are all early childhood stakeholders, I think that we can all agree that certainly challenges related to recruitment and retention have touched every community and every state, and I would wager probably every family and every employer as we have navigated the past 2 years. And it also highlights other work that's already been done on this issue. And then for ease, it highlights the workforce and capacity and access. And then we also sent out the appendix, and I dropped that into the same document in case we had any edits. I want to make sure, and we said this last month, we want to make sure that this is a meaningful process where we're able to discuss and have a good understanding of the recommendation, that the recommendations that we adopt and that we feel really good about them. So I'd open it up now if there are any members of the work group that would like to fill in anything that I'd missed. That this would be a good time to do that. And then we'll ask if there are any questions or recommended adjustments to this draft recommendation. So anybody from the work group, is there anything that you would like to share with your peers as they're perhaps preparing to take this recommendation and share and explain it in other venues?
This is Riva. I would just say that the group spent a lot of time trying to make sure that the suggestions and recommendations would be meaningful. We just know that without a workforce, we cannot address the childcare needs of families across the state, and felt like even though we know this won't fix things for the long haul, it would certainly be an acknowledgement of the hard work that our early childhood professionals do every day.
Thank you, Riva. I wrote that down, and we'll say probably that about verbatim when we present this to the Children's Cabinet on April 1st. So I appreciate it. And of course, we'll credit the good work of the group. Is there, if we're thinking about that framing, is there anything else that we really want to make sure that that Debbie and I would share with the Children's Cabinet when we're presenting them with this recommendation? I think Riva said it quite well.
Amanda, this is Sarah Gardner. I'm a facilitator for that group, and it is in there 2 different places because we felt it was important, but just to emphasize, this is not to take the place of a wage and compensation effort. So this is complementary to sustainability grants that are already going out. But this is not in any way to be taken as a recommendation that supersedes the idea of a broader wage and compensation plan for the workforce.
Thank you, Sarah. All right, do we have any questions about this recommendation? I counted to 9 slowly in my head. And do we have any, but before we decide whether or not we'd like to adopt it, does anybody have any pieces where they would like to recommend making adjustments to the recommendation? Terrific. Well, thanks, everybody. I appreciate that we've taken a really thorough approach to this, and that we've had a really good process along the way where people have been able to share their feedback, so that we had a really good solid draft that we were able to circulate. So the next piece is that we will vote to determine whether or not we would like to recommend that the Children's Cabinet adopt this recommendation. If we vote yes on this, then that means that Debbie and I will present this to the Children's Cabinet for their consideration when they meet on April 1st. So if anybody would like to, and I appreciate that we've had some conversation about some entities that will perhaps be making funding decisions about whether or not to implement this recommendation. So I'll ask for who votes in favor, who is opposed, and then whether there are any abstentions. Do we have any questions about that process before I ask for a motion to approve? Not hearing any. If somebody would like to make a motion to approve this, to share this recommendation with the Kansas Children's Cabinet and Trust Fund, I would appreciate that here.
Lucas Neese, I'll make that recommendation or that motion and recommendation.
Thank you, Lucas. And Mallory, I saw your hand up. Would you like to second that?
Yes.
Terrific. All right, everybody, we are old hats at this. If you are in favor, please either thumbs up or emoji thumbs up. Jennifer, I'm assuming that's a thumbs up and not yep. 11, 12, 13. Okay, I count more than 20. And then is anybody opposed? And does anybody abstain? I see 2 abstentions. Terrific. So this motion passes with more than a 2/3 majority, and we will go back and check the recording to get the exact count. But thank you, everybody. We appreciate it with 2 abstentions. So terrific. Go team. That is a quick celebration on Thursday morning or Friday morning. Gosh. And we'll now take a look at our second recommendation, which is from our Quality and Environments Workgroup. That is right here. So this recommendation, again, I'll read the recommendation statement and then leave the bullet points up on the screen for a minute so that we can review them. But this recommendation statement is that the Kansas Children's Cabinet, in its role as Early Childhood Advisory Council, recommends the State Interagency Coordinating Council and local interagency coordinating councils collaborate to implement the following strategies. Broaden local ICC participation and membership through strategies such as holding meetings outside the normal 9 to 5 hours, provide stipends for time and or travel, provide support in childcare or provide/support childcare for council members. 2, research funding opportunities to provide stipends to early childhood care and education professionals or family members for their time spent serving on the state and local ICCs. 3, promote communication of local ICC members to create awareness of community resources and share them throughout their communities to address the needs of children or families with developmental delays, disabilities, and or special healthcare needs. 4, sponsor community engagement events, provide informational materials, and identify how can these events and resources be networking opportunities while informing their community partners about the challenges of families and professionals in working with and addressing the needs of children with developmental delays, disabilities, and or special healthcare needs. And 5, propose monies be included in the state ICC budget to fund community projects proposed by local ICCs in support of the All In for Kansas Kids strategic plan, goal number 2. Thanks everybody for bearing with me, but I think that as we're trying to be really transparent in our work, it's important that we're able to share this so that folks who are following along on YouTube can keep track. Jennifer, is your hand raised?
Nope, sorry.
No worries. So I would recommend, just as I was reading this out loud, I noticed that this bullet point has 2 cans. So unless there are any objections, I'm going to delete this can. I don't hear any objections. Go team. And I'll hit save. So that is saved in the shared drive for later, Debbie. And we, so as with others, and then it goes on to highlight that this is intended to promote membership and participation of family members or early childhood care and education professionals, equitably engage with local early childhood care and education professionals or family members to elevate their voices, needs, interests, and contributions within the government systems of their local community. And 3, promote the All In for Kansas Kids strategic plan goal 2.1.1. It also includes background information. So it highlights the recently published resource from the Center for Law and Social Policy around engagement strategies. It highlights the importance of parents and early childhood care and education providers sharing gaps to services. And it discusses the All In for Kansas Kids needs assessment from 2019. Of course, it highlights, and I appreciate the close partnership with the State Interagency Coordinating Council in developing this recommendation, and it outlines the responsibilities of both the state and local interagency coordinating councils. It highlights why this recommendation is important, and it describes who is impacted by the issue. It also describes other potential connections for other groups in Kansas's early childhood care and education system who are connected with this issue. And it connects back to the following tactics and goals outlined in the All In for Kansas Kids strategic plan. It also highlights the next step. So if the Children's Cabinet approves this recommendation, then Debbie Deere, in her role representing the Children's Cabinet on the State Interagency Coordinating Council, will present this recommendation to the state ICC. So similar to last time, do we have any members of the group who have either pieces that they'd like to share with this group or pieces that they would especially appreciate that Debbie and I highlight when we present this recommendation to the Children's Cabinet when they meet?
Amanda, this is Debbie, and I'm the facilitator for this group. And I just want to say thank you again to all of the work group members for all of the work that has been put into this, the meaningful thought process that went into focusing on this idea from the very beginning and how it has evolved into what everyone is seeing today. So just can't say thanks enough.
Terrific. Thanks, Debbie. And do we have any questions about this recommendation? Not hearing any, would somebody like to make a motion to share this recommendation or to approve this recommendation and share it with the Children's Cabinet?
This is Emily Barnes. I move that we make this recommendation or and to move it on to the Children's Cabinet.
Thank you, Emily. And I heard somebody come off mute. Oh, sorry. Go ahead, Sheila.
This is Sheila Bertelson, and I second that.
Thank you, Sheila. All right, everybody. If all those in favor could either raise their hand or do a thumbs up emoji. Terrific. I see more than 2/3. Is anybody opposed to this recommendation or to this motion? Not seeing any. Would anybody like to abstain from this vote? I see 1, 2. Terrific. This motion passes, and we will also share this with the Children's Cabinet on their April 1st meeting. The last piece that we have is not a recommendation, but it is an important message from the Family Partnership and from the Family Partnership Work Group. And this, so there had been work underway, and this sparked some really excellent conversations with the members of that work group and with others who are working on family engagement and partnership in the state. And so as we were trying to wrestle with exactly what to do next, it didn't seem to make a lot of sense to share a recommendation with the cabinet to continue the work that was already underway to develop a recommendation, if that makes sense. And somebody else from that work group might have a better way to phrase that. So the work of that group has been taken and has been handed off to the family leadership team. And the family leadership team will now begin the work, the next step of reviewing existing definitions and determine next steps for either adopting some existing language or develop something new. So that work is continuing, but that's why we're not seeing a recommendation today. We might see that in the future as should there be the work that comes from that to determine what is next for our Kansas early childhood care and education system. And this also highlights that the family leadership team is going to be expanding to include more family leaders and community-based organizations, and that the work group will be discussing that when they meet today. So this also highlights the next steps for that group. Would anybody from the Family Partnerships Work Group like to share anything additional on this? Cassandra, I think that I saw you come off mute.
Well, I'm not part of the work group, but our meeting for today had been canceled.
Okay. Do we have anything else to share on this work? All right. So not seeing any, that brings us to the next item on our agenda. So as I shared, this will be, Debbie and I will be presenting these recommendations to the Children's Cabinet when they meet on April 1st. And then when we meet in April, we'll share back any feedback from that group. But now I'll turn it over to Debbie to discuss what is ahead for the panel.
Thank you, Amanda. So as your work groups progress today, starting into what I'm calling phase 2 over the next few months, I wanted to touch on a few points of what that might look like. And so I think that we can all agree that since the start of the work groups last August, we have learned a lot through this process. I think the original thoughts as we went into this were that each group would identify one or more topics and issues to focus on and then work towards the development of a recommendation for that idea. And so as we know now, a recommendation is one of the end results that is possible, but that isn't the only option that we might have to choose from. And like we've learned through the family partnership work group that Amanda just shared on the update on their shared definition and for what family engagement is, you could decide that you can identify another group within the governance structure to partner or collaborate with, as well as another agency or organization or any early childhood stakeholder group that's relevant. So perhaps one of those groups is already working on an initiative that is similar to the need that your group identifies to work on. And in the beginning, I had touched on the point that we encourage the work groups to complement rather than compete or duplicate the work that's already happening throughout the system. And this type of an approach completely makes sense coming from the panel. If we could go on to the next slide. So what might your group's process look like in phase 2? You will meet today for a short time to begin the discussions of what you want your next few months to look like. And what will your group determine to be meaningful work, kind of like we did back in the beginning. I know that each of the facilitators has talked about the idea of going back to the jam boards as a starting point for those discussions. Some of you might have topics that you touched on during phase 1, but didn't have time to pursue yet. And you might want to pick up from there, or others might decide that you want to identify a completely new issue or path to take. And there's no set rules or timelines for any of this. And as facilitators, Megan and Sarah and I want to be available to help support your work in whatever ways you decide are necessary. But we also want to make very clear that we encourage all of you to be in the driver's seat for identifying what you want those ideas to be and how you want to move that work forward. Keeping in mind, of course, the parameters that the panel can work within. And so in this process, your group members will work together to identify new focus areas or issues and also identify any connection points or new content experts that you might want to bring in or other groups that you might need to include that can support your work. And also it's okay if the timelines of getting the work completed vary between your groups. During your report out time, at the end of each meeting, your group will always be able to keep the full panel updated on where you're at in your progress. And it could also be helpful if during those report out times, if any panel members have information that can be provided to your group for additional resources or connection points or contacts that you might want to consider in order to move your work forward. So if and when you reach a point where you have a potential recommendation to bring for consideration, then that process will begin to take place, just similar to the way it has leading up to today that we just got done voting on. So this is very similar information to what I shared with you back in July, but that was a long time ago. And, again, I think what we've learned that I want to emphasize is that your work doesn't necessarily have to result in a recommendation, but if it does, that's great too. And then, we'll move it forward accordingly. So that's all I have to share on that as we head into our breakout sessions. If anybody has any questions or additional comments, I'd be happy to field those right now. And then otherwise, we'll go into breakouts for about 30 minutes today.
Debbie, this is Amanda, and I'd love to share perhaps a word of encouragement or a challenge. You can decide how each of you hear this, but I see really incredible leaders on the screen, and I know that we have so many folks who are responsible for projects either at the local level or the state level. I'd really encourage you to think about the panel as a terrific resource that we have available in our work. I know that we have a lot of projects where we say, gosh, we would really love to be able to gather feedback and do this work in a collaborative way or a transparent way, where we would really like to be able to get feedback, but where the work of actually bringing folks together is tough. I'd encourage you to think about this panel and this resource as you're work planning, to say, gosh, how might we be able to utilize this resource that we have available when we need a call to action for helping spread the word on something, or when we need to gather some quick feedback to help us determine the direction that we're going. So please do be thinking both what new things might we be able to do, but also for the existing work that we know that we'll be doing over the course of the next several months. Are there opportunities for the panel to be a useful resource for you as you're doing that work planning and then implementing that work?
I am going to put in the chat the links to join the other Zoom meetings if you are either in the family partnership or childcare recruitment and retention group. And then the quality and environment work group, as a reminder, just stays in this main room.
And Debbie, incredibly enough, we're only running 5 minutes later than we thought we would on the agenda. So do we want to plan on coming back together at 10:05?
I think that should be fine.
Good deal.
Hello, work group.
Hello.
For some reason, it feels like it's been a while, but I don't know. Maybe it's just me.
Well, and we did officially meet as a group last month, but yeah, it does feel a little bit longer.
Yeah, I mean, we met briefly, but it feels like a while since we've actually gotten together and done major work. But we kind of designed today's meeting to be shorter, and I guess just to start the conversation with all of you about, what do you want to happen next? And like I just got done saying, I want you guys to be the deciders of what that might look like. And I do have our Jamboard that I can pull up to kind of remind everyone where we left off. And, some of the Jamboard contains, has the information from the recommendation that we just pushed through. And so all of those can kind of be checked off, and, that's an accomplishment. But then there were other ideas that were on there left. And like I mentioned just a minute ago, do we want to take another look at those? Do we want to, just start completely over and come up with something brand new? I know some of you, I remember seeing an email from Emily that had come through midstream maybe this last time around, and you had some ideas of some quality and environment type issues that you were wanting to bring attention to. And then others of you, of course, have mentioned things along the way. So Lucas, I'm going to I know we didn't talk about this ahead of time, but I'm going to throw this at you for a second. And if you or anyone else has any thoughts about what we want to do, and then I definitely can pull the Jamboard up too.
Well, I think, I have a thought that because I've heard about some things that are being discussed by legislators in Topeka that make me pretty nervous, but I think it would be interesting, if folks who have things that they'd like to talk about, what's one thing that you'd like us to consider? Please throw it out there. Emily, are you?
Yeah, I was starting to come off mute. So Debbie had referenced an email that I had sent it mid to late fall, something of that nature. And I think it was when we walked out of the October meeting, I couldn't shake this feeling that in some way we have to get the provider voice. And by provider voice, I am including center staff in this as well. I'm using provider collectively. I'm exceedingly proud of the recommendation that we just put forth. I think it's amazing that we came together and we talked about this, but part of how it came together was Cassandra voicing issues that she had faced as a mother of children with special needs, and that me as a professional in the field saying, actually, she is quite valid, and here is the corollary to this. And so we were able to make a very strong recommendation based off of the voices of the people who were personally affected by what we just put forth for recommendation. And there is, right or wrong, there is a sentiment when you work in this field that decisions are made to you, not with you. And I think one of the things that as a work group, we could increase our effectiveness if we are mindful of the fact that legislature is making decisions that are going to be done to the workforce. And they're not necessarily in collaboration with the workforce. And when regulatory things happen, that a lot of times that is perceived as being done to the workforce, not with. And I would like to see us spend some time working on ways that we could collect that provider voice from the different environments. I know that there is effort already going on, so we don't have to reinvent the wheel. DCF has been, like CCPC and DCF, we've been in talks about some efforts. And so organizations are doing this work. I think that it's important, the fact that we managed to break through with this idea of outside of 9 to 5 hours. We have a workforce that overwhelmingly wants to show up to things like town halls, to participate in the conversation, and they will ask incredibly poignant, strong questions. And it's not just anger that you're hearing, it's concern voiced in a question that deserves an answer. And so that's what I would like to see us spend some time doing, is putting effort towards that.
I completely agree, Emily. I mean, we can't make decisions without hearing from the people it's going to affect. And that's why I'm so passionate about family engagement and love the work that KDHE does with the Family Advisory Council. And I'm thankful that I can be a part of things like this and the Family Advisory Council and other advisory boards that I'm involved in, because I have that personal experience. And if we don't listen to the people that have that personal experience, we don't know what we don't know, and we don't understand what they go through. And that's what the people in the legislature don't understand. They don't know what a special needs family goes through. I would love to say, come live in my house for a day and see what I go through. And maybe then you'd understand. I mean, the ARC of Sedgwick County, which is now Ability Point, they've invited legislatures to come view their programs. They won't come to that. And it's sad. And it's like, hello, we want you to see what we deal with. But then they make decisions that's going to affect these individuals' lives and their families. that they have no clue what it's going to, how it's going to affect them. So I completely agree.
Can I jump in for a second?
Sorry.
A couple of thoughts that I had. Emily mentioned something about regulatory, and we have Paula on here, which is a great resource for some of the childcare regulation stuff. And I just want to say too that the childcare systems improvement team has a group specifically that does those types of things. So if you do decide to go that direction with anything, you know, we might be able to loop some of that work in and you know, connect there, and maybe something you're thinking about is already something they're working on. So there's that point. And then to Cassandra's comments on, you know, legislative issues, and Lucas mentioned this too. Obviously, as a panel, we cannot get involved in lobbying issues, but we can do educational things. And, you know, so what I'm hearing you say, Cassandra, is maybe, you know, bringing more awareness and, you know, those voices to the table and, you know, the education thing. So I did want to throw that out there to keep it in mind as you kind of decide, you know, what direction you want to go, if that helps at all.
Debbie, just, I mean, I know you have to keep me on a short leash, and I see Jennifer and Rachel have your hands up. I want to, but help me to understand, what's the difference between lobbying and educating, and, you know, maybe making a proposal that is responsive to some of the legislation that has been floated. You know, I have heard that there are legislators, very influential legislators, who would like to radically change ratio in childcare. I have heard doubling numbers of children, which is alarming to me, and want to respect that we don't lobby. You know, I think I would imagine that people on this panel might have thoughts on, boy, you could add a child there, you know, versus doubling. And would it be appropriate to make some sort of a recommendation on, here are 2 rooms where we think you could add a kid without negatively affecting quality. And Debbie, you can either respond to me or we'll get to Jennifer and Rachel.
I'll respond real quickly as far as I know that in other conversations similar to this on lobbying versus education, there are some examples that we can pull from that we would need to research on what that might look like and how we can address the issues that are of concern, but in a way that is appropriate for what the panel can do. So I think that there's ways to get those messages across that would be appropriate. And I don't have anything additional beyond that, but, you know, I don't want to shut that door on the concerns that you have. So I'm going to let others speak up and share what they're.
Jennifer, please.
Hi, sorry. Yeah, I don't want to derail this conversation, but I do want to go back a couple of minutes ago to some of the initial thoughts and conversation that Emily started around the need to, you know, be gathering information and asking questions from the people that are doing the work, the providers in this area. And I'm just curious as to if, you know, you, Emily, or Cassandra had ideas or thoughts on the types of questions and things that we should be asking, and what areas are needed. You know, where are those areas of additional information in terms of you know, trying to gather that from the workforce.
So this is Emily. I'm going to pop in real quick. I know back, I think it was the fall, there was a really extensive survey that was sent out, and I'm blanking on who sent it out.
That would be the Workforce Advisory Group. I'm pretty sure.
Okay.
Yeah, and I was involved with that, so I know the content. So I'm just curious, like, from your perspective, like, what additional things we could have included.
That was probably one of the most comprehensive and validating surveys I have ever participated in. I felt like it touched almost every nook and cranny of our field. And so that might be one place where we start, is we kind of look at what was the response, and was there an overwhelming area or multiple areas? You know, does that tool give us feedback? I kind of come from the camp of don't reinvent. If we already have something, don't recreate. So let's utilize things, you know, childcare aware, they continuously are putting out, you know, surveys and check-ins and things like that. And so it might be that we sit down and we say, are we getting feedback that is valuable and important? And do we already have that compiled? And therefore that gives us the idea of where we go forward. Do we need to, you know, CCPC, Child Care Provider Coalition of Kansas, we've been able to host a couple of different town halls. Is it one of those things where we take some of that feedback, we create a town hall environment, and we start, you know, we maybe come to the town hall with 2 or 3 different questions, knowing that we can't approach everything, but we could say, hey, these are 2 or 3 big topics. Let's see where the conversation goes. You know, is it something of that nature? And that's kind of where my brain goes. And I don't know that we need to make this a long-winded process, but I think that we at least start somewhere around there.
Thank you. I just want to say how much I appreciate your comments about the survey. That really makes me smile to hear to hear you say that. That was absolutely the intent behind it, and I would certainly be happy to, you know, have further discussions about the data related to that. And there are many ways to be able to look at that. So, and I guess I would leave it up to others to, you know, kind of make that determination on, you know, what we would need to pull together and, you know, I guess, analyze or dive deeper into some of those things. And so, but yeah, thank you. I appreciate that. And I don't know if Cassandra, if you have anything additional that you want to add.
Well, I mean, since I'm not a provider or a childcare workforce, I'm just a parent. I mean, I would want to know if the people in the centers doing the work are getting the training that they need, are getting the validation that they're doing a good job. Especially in the area of, you know, what if you have a child that has some behaviors? You know, are you getting the appropriate training? Are you getting the support that you need? Because it can be difficult. And so, you know, around that, are they getting what they need to do the job appropriately?
Great, thank you. I really appreciate that. Some of that information was some of the training components was collected on the needs assessment survey last fall. So there might be some information in that could be relevant to and speak to some of the things that you exactly said. But anyway, I'll stop now. I know that there's other people that
Jennifer, is that a link you could send out to us? Is there a report or?
There is not a report, unfortunately. We're in the process of still trying to work on doing something formal, but I do have information that I can share that's in draft form that we have been sending to partners that can be used internally. So I guess I would just say that if that is something that this group is interested in seeing, that it just be used for this group until we can have additional information more formal, because there's partners who were involved with the creation of the survey, and we need to make sure that information, which in the formalized report, as you probably are all well aware, needs to be identified on that, and we just haven't had a chance to get that finalized.
I think that would be very interesting if that's something you can share with this group. Paula, you double raised your hand, so knowing that Rachel's next, but Paula, you double raised your hand. I'll come to you. Go to Paula or to Rachel. Rachel,
please go to Rachel. I was going to say on my screen you're pointing to Debbie, so I'm like confused. I'm only gonna say mine's really short because I think we've covered it. But Emily, I know you were previously on the town hall that was done between KSAYC and CCPC together. I still serve on the KSAYC board, and they're looking at doing more town halls on a regular basis to be able to get that information out, because I agree surveys are great, but providers are busy and they don't always get to those. And so I think giving it to providers in multiple ways and getting that information out is very strong and very helpful. Links to Quality also had a statewide learning community meeting where the providers all came together and talked about some of their wins and some of their losses and what they were needing some help with. And I'm going to pass it on to Paula because I'm sure she's going to talk about the ratios, which is being covered in the child care system improvement team.
Actually, I wasn't going to talk about that. What I wanted to add was several comments based on what has been said. The first thing I wanted to mention was the talk about making sure that we get provider and parent input. That's very important. I just wanted you to know, I think Debbie mentions this, that the SIT team does bring in provider, the child care systems and improvement team. It's called the SIT team, so that's a double team, but you get what I mean. And they're also going so far as to having meetings in the evenings now, so that providers have more of a chance of showing up. So next week's meeting is Tuesday night. So on that one. The second thing I wanted to mention is the question about the difference between lobbying and education. Basically, as state employees, we cannot take a side per se. We have to stay sort of neutral. What we do instead is that education piece that Debbie mentions. What we do is say, okay, if this legislation passes, here's what's going to happen. Here's going to be the fiscal effect on KDHE, specifically for me, would be childcare licensing. And then other agencies, any kind of regulation that comes up, they will do the same. And they will present their testimony saying, here's what's going to happen if this passes. Here's how it's going to affect us or not affect us. And it's very neutral. And so that's the difference. Whereas like if you work for a nonprofit and you are, let's say Douglas County CASA, I just rolled off the board of that one, so that's fresh in my mind. Then they can lobby. That's their jam. And the executive director there is really great at doing that. So I hope that helps with a little bit of understanding of the difference between lobbying and education. We can't say, please do this, please vote this way. We can't direct them to vote anyway. We just tell them the effects. So the next part is when Cassandra was talking and she was expressing her frustration about how elected officials, you've invited them to come down and see a day in my house, see what's going on. And you get ignored and not paid attention to. This is just one citizen talking to another right now. That's why you got to pay attention to who you vote for. I mean, if that's the person who says they're for you, but then they go and vote differently, I know that's a lot of time consuming thing for people who are parents, especially if you have kids with special needs. But if you don't do it, then these people stay in office. And I'm not saying they will always get the person you want in office, obviously, but man, it's so important to pay attention to those local elections. But that's just kind of citizen Paula talking. So, but that's all I had. And we're aware of the whole ratio situation. And actually that came up like at the beginning of session. And that was, we did our testimony like we do, which is here's what's going to happen if that's going to happen. And, we're looking at legislation to change ratios in a way that makes it easier for providers to comply with regulations and keep children safe and not put 20 million children under the age of 18 months in the care somewhere. That's not going to happen. So at least not if we can help it. So hope that helps some. Let me take my hand down.
Thanks, Paula. Megan, you were up next.
Yeah, I'm going to go back a little bit on the engagement piece. One thing that we are hoping, that we're planning on doing too as part of the relief efforts is continuing some of the stakeholder engagement sessions and hoping to partner with some different groups. But what our primary goal is we know that there's been a lot of engagement sessions and there's been a lot of surveys and there's been a lot of feedback. But one thing that we're trying to do is pull all of that together and go, what has already been asked? Like how can we sort of cycle that back through? How can we take that feedback and bring it back and connect the dots of how some of the decisions have been made based on that feedback, and being able to try and continue that cycle, and more importantly, continue the conversation. So we're hoping to do those next month. So keep a heads up for those. And I think we're going to maybe try and do one at the recommendations panel as well. But the intention of those are very, very much to be a continuation of the conversation. And like I said, pull in some of the data like that. I know Jennifer's talked with us a little bit about bringing in some of the workforce development data and how can we continue the conversation, as well as some of the data that Child Care Aware has done, or some of the stuff that PDG has done, and some of those conversations, and going, okay, we know you've had these conversations. How can we take it to the next step? Or also how we've heard those recommendations. Here are some ways that we are hoping to implement those to help with that. I will say too, Cassandra, we are trying to find a family engagement session so that we can connect with families. I'm still looking for one. So recommendations are great, because another point of those is we are wanting to go where people are already at. We're not trying to make new meetings. We're not trying to make another opportunity for people to have to work at night, or, you know, we want to go, okay, you're already coming to this. You're already participating in this. So can we maybe take a small section of that and really make sure that your voices are being heard and understood as well. So just wanted to kind of give a little bit of an opportunity heads up in the next month, hopefully.
Thanks, Megan. Emily?
I did want to make sure to mention like about the SIT, the SIT team. When that began again, I know that very past, it used to be the best team, and then it was like spring of 20, somewhere in 2020, and then, you know, somehow it came back as the SIT team. It initially did begin in the evenings, and there may have been details that some people weren't privy to on why the decision was to take it back to the daytime hours, but it was voiced basically that like there was a desire to not be in the evenings. And I know of providers who were trying to be involved in the SIT team when it was in the evening, and then they felt as if they were edged out because it was moved exclusively to the daytime hours. And so although I do feel that it is good that we have made this effort that every few months there will be an evening time meeting, it does need to be acknowledged that at first it was the evening and that was taken away. And so there may not have been a strong presence in the beginning, but that was also a stage when providers were still even learning that their voice did actually in fact carry and have some weight to it. And so I at least want it out there for people to remember.
Okay, and I wouldn't have known that obviously
right,
since I started in December, but it's a good thing it's not that way now.
Right, it's helpful, but I know like even for me at one point you're looking, you know, because I'm going to try to I need to fill out the application to get myself on that team, so I can be there. But like, you know, one of the things was, you know, we hope that members would be there consistently. Well, I make it a priority to be at this meeting, and either, you know, like today for various reasons I'm closed, or I always make sure that I have, you know, my sub in the building to help me with kids. I can only do that so many times a week. And so to know like there are other meetings during the day, and eventually I can only make so many meetings in the evening. So it's one of those things like I would like to see intentionality on, you know, if SIT team is going to stay as it is, which is a reasonable compromise, then making sure like we're addressing like the stuff with, you know, Megan and Jennifer, like how are we being intentional about the way that we're connecting, finding that voice. If the only way to get people at the table is once a quarter, well, then those other 2 months, are we making sure that a representative from the SIT team is actively connecting, you know, like as somebody on SIT team and connecting to CCPC? How are we doing this? Or, you know, like, is Rachel able to connect to links to quality participants, you know, things like that. And so it's just all about the intentionality.
Thank you, Emily.
Yeah, I agree, Emily. It used to be at 6 o'clock on a Tuesday evening. And I mean, even I, as a state employee, I went to that meeting. I mean, you know, I saw the value in having it in the evening, and I don't know that I ever even heard why it moved to 10 o'clock on a Tuesday.
My
So,
understanding, there was a person who didn't want to meet in the evenings and changed it.
The next meeting is at 7 p.m. next Tuesday to 8:30. And they're every other month are going to be evening meetings.
it's every third month, isn't it, Paula?
I'm new, but I thought they were every other month. So
I think it's every third month was the one I printed off, once a quarter, 2 meetings during the day and 1 in the evening.
I was pretty sure it's once a quarter.
I'm going to jump in really quick for the sake of time. My job as facilitator is to keep us on schedule. So it's 10 o'clock. We have 5 more minutes. I want to put out there that what I'm hearing is a lot of great ideas. I didn't share the Jamboard. What I think I'll do is share that out with everybody after this. Please look at it, plug in whatever ideas or thoughts or connection points or anything that you have that we can just hit the ground running with next month. And we'll have a longer breakout session next month. And then also for a lot of you that have made references to different surveys and whatever the resources are that you can and want to share with us, if you get those to me, then I can make sure and get those shared back out with the work group, so you can take a look at them and help facilitate that. And one that wasn't mentioned, but I think would probably have some valuable information is the childcare mapping experience data that was gathered a few months ago, and that is living on the Children's Cabinet website. So I can share that with everybody as well. But we have a few minutes for about 6 minutes for some more comments if we need to use that time.
Paula's got her hand up.
just double checked my calendar. The meetings are monthly.
Yes, they're monthly, but 2 are during the day and 2 meetings are during the day and then 1 is in the evening.
Right.
Yeah.
Is there anything else that folks have on their minds? Maritas, did I see your hand up?
Yes, I just want to appreciate all the discussions today. It's really helpful for someone like me who is watching on the sideline. In terms of training, if any providers is in need in terms of deaf blind or deaf blind, which is of the lowest or very low incidence disability in the state, then we will be glad to provide this training. Contact me and it will be at no cost to you.
Thank you, Maritas.
And I think when you see the Jamboard, it might remind you, if you've forgotten it, that was one of our things that were brought up as a possible focus area the last time, was additional trainings for providers and individuals for with disabilities, and how that could benefit them. And I know that there's some of that going on already, but you'll see that on the Jamboard.
Well,
sorry,
yeah.
I would just like to piggyback off of that. I think that would be great for our providers, even childcare providers, all providers of early childhood, because that's something that I feel like I see as an education specialist within our program is a need for our teachers. And that's something that we're looking to provide professional development for our children, to make sure that we have an inclusive, truly inclusive classroom. And then to make sure that our teachers feel like they have all the tools and that they need to teach the children in that environment.
Thank you, Sheila.
And to just further elaborate on that, I think some of the comments the last time too around that were that it would hopefully additional training would increase capacity for providers that can provide those types of services. So it is 10:02. Do we want to just take a 3-minute break and then wait for the rest of them to join us back in? And then we'll.
Sheila has her hand up.
Oh, sorry. Thank you.
Yeah, I think a
Okay.
3-minute break makes sense.
Yeah, no,
Thanks,
I don't
Debbie,
think-
for the work that you've done.
Hey, Debbie. I just had a question. Where would I find updates on early childhood legislation that's proposed? Where would we, I mean, this might sound naive, but my head is in many different directions. I wear many hats. And so,
The first place that I would recommend is the Kansas Action for Children website. They specifically advocate for all of those types of things. And, you can look on their website as well as reach out to Mitch Rucker, who oversees that for KAC. And I'm sure he would be happy to have a conversation with you and answer any questions that you have.
yeah, thank you. I just wanted kind of like a one-stop shop if there was anything there. Thank you.
Sheila, you can also get on their mailing list, and during the legislative sessions, they do a weekly update that they send out. So through their website, you can get, those weekly updates.
Okay.
And otherwise, I think they're monthly or quarterly. Amanda may know when the CAC sends out their updates on early childhood. I know during the legislative session, it's weekly because I get it, but outside of legislation, I'm not sure.
It used to be monthly.
Thank you.
How's life in Dodge City, Sheila? Did y'all get snow?
We received a little bit of snow. I traveled to Wichita last night. My son, they played in their at state and they
Oh,
lost,
fun.
but they got there. So
That's awesome.
The season's over and it was my last game as a mother of 4. He was my baby. So I'm done with sports.
Wow. Yeah.
I have more time on my hands.
Yeah,
a friend
Sheila,
of mine.
that's
Oh, go ahead.
Yeah, go ahead, Amanda. I was just saying that's the hard part. It was funny because when I had 2 kids both playing sports at the same time and I was going all the time, one of the coaches told me, you're going to try to figure out what to do with yourself after they're done. And yeah, it is totally true because I'm like, yeah, not a clue.
I have to say, I so get that. I was a soccer mom and I was so happy when it's over, and I can't tell you how much I miss it now.
Yeah, I mean, travel clubs. I mean, my kids played sports all year round, and it was just like on the go. If I wasn't with one child, I was with the other, and yeah, so it'll be a new experience, So thank you. I had my first breakdown in the fall when my son ended his football season.
Yeah, senior night.
Yeah.
Yeah.
Well,
those
it was
are
when they
hard.
played their last game, and it was like, you don't allow yourself to say this will be the last game because they're trying to compete to keep going forward. So you never, like you're not even going to go there because you want to make sure that you're being positive and move straight forward. But once I realized the game was done, and I was an ugly mess. I was Eastern Kansas.
It's snowing. We needed the moisture, so
yeah,
it's good. I am ready for it to not. It's apparently supposed to be warm next week for spring break, so I'm excited for that.
Yeah, I agree. I think everybody's been looking to the weather.
Yeah.
Enjoy.
What are the roads like out toward like Manhattan and all that? I'm supposed to head out that direction a little bit later today.
Between somebody might be closer. Between Lawrence and Topeka was not bad today. Natalie, how was it north of Topeka?
The roads were great. Even in Topeka were great today. So 70 and 75 were looking good.
Yeah, I think, Emily, I think the highways are fine. I think you shouldn't have a problem there. Now, I live in Topeka on a side street, and it's not great, but it's manageable. My driveway's great, the important things.
We'll have to ask Jennifer Forker in a minute. Go ahead, Emily.
Luckily, my husband's sending me in the truck, so I feel confident I should be okay to get there. I was like, I might want to just ask.
Make sure you have sandbags. Oh, just make sure you have sandbags.
Amanda, what were you going to ask this morning?
Oh gosh, Jennifer, I was looking at the wrong Jennifer. I should have said Jennifer Francois. Sorry.
Oh, okay.
We were asking about the roads around Manhattan, and I got my Jennifer F's mixed up. They're not mixed up, but you know.
Well, I'm listening to the conversation because we're headed to Council Grove this afternoon, and then on to my daughter's in Lawrence, and she's bringing us her dog for spring break. So I'm hoping that the highways are clear and she'll be able to navigate that without any problem. I'm sure she will.
And to answer your question, Amanda, to be honest, I have not been out of my house since Wednesday evening. And so, but it looks, it's sunny out here right now, and it looks like that there is traffic flowing. My husband actually works in Newton, and so he left this morning, and he apparently made it. So at least I think he did. So I guess the roads are okay.
I'll help you out a little bit. Roads are great. Roads are great around Manhattan. So
that's good to know. Good to know.
Go team. The joys of a good statewide bunch, right? We've got plenty of road tracking. Terrific. Okay, so we now, I think that we are all back. I see folks from all three work groups back together. And so we'll take some time to report out from each of the work groups, and we will I'll leave it on the screen so that we can see faces and have conversation if needed. And I will start with childcare recruitment and retention.
Hi guys, this is Kelly Mark. I'm the child group work group retention. Lost that whole title of that work group. Retention, workforce retention. So we had a great conversation, and we talked a lot about how our formal recommendation we put forth was for the bonuses, for the retention bonuses, and how Sarah reminded us that that wasn't to be a replacement for actually working on this wage issue that everybody's talking about. So we talked about, is that something that we could do? Does it belong in our group? Does it belong somewhere else? We talked about what data we would need to tackle something like that. How do we get that data? Who else is working on this issue? Who do we need to align with? Is there anybody that's actually tackling this wage issue? Is there everybody just talking about it? We talked about who else out there is doing work across the country. Is there anybody we can partner with who can come present to us? How can we get resources and see what else is happening? So we didn't make any formal decisions, but we had a super great conversation, mostly about this huge issue of wages and what could our role really be in trying to tackle that issue. If I missed anything, guys, please feel free to chime in.
Thank you, Kelly. Do we have either any questions for the group or any additional comments? I see a hand claps from Reva. Go team. All right, thanks everybody. Next, family partnerships.
Good morning, Crystal Henry. I'm a co-chair of the Family Partnership Work Group. And we started by just circling back around to what Amanda presented earlier about, having the family leadership team really own the process of the shared definition of family engagement, and just stress the importance of, when we're talking about bringing people to the table, we're talking about bringing families. So if a recommendation is made to engage a certain organization, that the express intent is to have them bring families to the table, and that representation was across state. representing rural and urban areas and the like. So, just making sure that this is done well and intentionally, and that people aren't left out of the process. Then we're pivoting towards this issue of navigation, family navigation. Is a huge need as identified in the needs assessment and part of the strategic plan. It was stressed that there's never going to be a one size fits all, right? So we're never going to be able to put all our eggs in one basket, and families sometimes need a physical location, sometimes need a phone number to call, sometimes need a website to go to. So we talked about some things that are happening right now in the state. This group should be familiar with 1-800-CHILDREN and the efforts that have been made to connect families with resources in that way. Also, KCSL is moving towards creating physical family resource centers. We just briefly touched on Help Me Grow Kansas and Navigate EC. So there's multiple things that are happening to address family navigation. So we decided as a group, let's learn more about that. Let's invite people to the table to talk to us, do our own homework, and at that point, we can identify, okay, can we provide, can we support focus groups towards this work, or help create family councils for a group? So there's lots of possibilities here, and we just really want to familiarize ourselves with what's going on, their processes, what their needs are, and just figure out how we can support that along the way. Anything else, group?
Terrific. Well, thank you, Crystal. Do we have any questions for the group? Then the last group to report out is Quality Environments.
In Quality Environments, we were pretty focused on wanting to make sure that we were engaging childcare professionals, making sure that the various, I think, mostly state organizations that are doing work that impacts childcare providers, that they are engaging childcare providers, and that those things are happening at times that childcare providers are able to participate. A big down with daytime meetings is kind of the big takeaway there. Wanting to, how do we make sure that we're going to where providers already are? What can we do to avoid creating new meetings? And that's the bulk of what we talked about then. So.
Here in Huzzah to trying to avoid creating new meetings, Lucas and team. Do we have anything to add or any questions for the group?
This is Emily Barnes. In addition to not creating unnecessary meetings, utilizing tools, the survey from the workforce registry, that effort from the fall, that was referenced. And so, trying to basically focusing on intentionality of what does the early childhood professional voice say, and how do we use that? And let's not reinvent the wheel with new tools. Let's use what we have. Let's, utilize the organizations already doing that work, and just be intentional about how we get that voice heard and elevated and go forward.
I love that. Thanks, Emily. Terrific. Well, that wraps up that component. So I'll turn it over to Debbie and share my screen to talk about future agenda items.
Thank you, Amanda. And I'm going to piggyback a little bit on what Amanda shared a little bit earlier on bringing work to the panel and future agenda items. So I know that we always extend this opportunity to you at the end of each meeting to chime in and share anything. And of course, you can always reach out to myself or Amanda if you have something. But please know that there is agenda time available over the next few months. And so while we do have a few topics that we're keeping on the radar that I anticipate will bubble up sometime, we none of these are quite ready yet, but we've been successful so far in year 2 of the panel to check off many of the topics off of our list that we started last July. So I consider that great success, and many of you were involved with making that happen. But I just want to again reiterate what she said, that I want you to know that at the appropriate time, there's so much work that's happening within all of your agencies and organizations that can be brought to the panel at the appropriate time. Do you need some type of support from the panel members or feedback as you've experienced many times, or if you have a specific ask for how the panel can help best move your work forward? And this was the purpose behind the governance summit back in January, was hoping that you could, when this information is brought to the panel, it not only sparks conversations and collaborations during a panel meeting, but also continuing beyond that between the various partners behind the scenes, if you will. And the other thing that I wanted to touch on is it's also important for all of you as panel members, as part of your role in serving on the panel, to share resources from your agencies or organizations work with the panel anytime that you feel it could be relevant to what's being discussed. I mean, this might be in the form of a report or a newsletter that you routinely do, possible survey results, which were just referenced from the Quality and Environments Workgroup, or some other type of data that you've collected, committees and councils maybe that are happening within the work that you do. That maybe the panel members could benefit from participating in. So anytime you feel that you have something appropriate that you are able to share out, either during a conversation that comes up during the meeting, or information that you can send to me that I can share out in the pre-meeting or post-meeting emails to all of you, I strongly encourage you to do that. You're always welcome to reach out to me again to help you in disseminating any of that. And I think we all know this, but as a reminder, the panel was designed during a very historic time for early childhood in our state, to be a unique group of individuals, and we all represent a very wide array of early childhood stakeholders that can come to the table together to identify and address these needs throughout our mixed delivery system. And so I just want all of you to always feel welcome and empowered to think of ways that you can best contribute to all of the partners involved here and all of the efforts that we're all working on together. So, in a nutshell, please bring me agenda items if you have any that we can help you with, and we want to be able to do that. So please always keep that in mind. So that's all I have on that. Thank you, Amanda.
Sure thing. And Sarah, go ahead.
The ask sparked an ask from me. We are updating the statewide needs assessment. So we did a comprehensive needs assessment with our initial PDG planning grant back in 2019. That's the very, very large document that we often reference. Last spring, we did an update for calendar year 2020. It's much shorter. It's only about 20 or so pages of information, but it just presents a snapshot and an update of some of those data points. We are doing the same effort again this year, so it will cover calendar year 2021. Spoiler alert, you can look for the same thing coming next spring that we will do with our preschool development grant. So my ask is, if you have any surveys, if you have any data sets that speak to a unique need, and it can be a regional need, it can even be a local need, that you think would add flavor and context and benefit for the state to see in the statewide needs assessment, please send that information to me, and I will connect you with Heather Schroepberger, who is our lead on the needs assessment work. We want to make sure it's useful for all of stakeholders and that it represents all the needs across the state, many of which you guys are doing the hard work to gather and assess. Thanks, Amanda.
Thanks, Sarah. This is spooky. When Emily had highlighted that they were going to look at reviewing existing surveys that had been done for the year, I had written down for you that we might want to ask the panel if we had any surveys to share for the needs assessment. So go team. Thank you, Sarah. Do we have any other requests for future agenda items that we have at this time? And if you don't have them now, you can feel very welcome to share them with Debbie after the meeting as well. All right, that brings us to the end of our meeting. Do we have any bright spots that we would like to share with the group today before we wrap up? I'd like to celebrate the bright spot that we did really terrific work and that we had a really thorough process to vet and review and think through recommendations that we'll be sharing with the Children's Cabinet on April 1st. And I want to say kudos to all of you because you all did the really hard work to make that happen. Cassandra, go ahead.
Well, I mean, I want to thank everybody for all the hard work that they've been doing, but I have recently become a trainer for Connections Matter and Youth Mental Health First Aid. So if anybody has any need for those trainings for their parents or staff, please let me know.
Thank you, Cassandra. That's so important. We really appreciate that we've got folks in the state who are making sure that we're getting people equipped with tools to be able to support mental health. Any other bright spots to share with the panel this morning? Go ahead, Jennifer.
Well, I want to say thank you to Amanda. We had a great presentation on Wednesday to the Early Learning Caucus about kindergarten transitions work in Kansas. So that was a lot of fun. Just personally, it was a lot of fun, but a really great opportunity to share. And I think made some good connections with some of our state legislators. And then I also, and I'm going to totally embarrass her here, but I wanted to let everybody know that Kansas Head Start Association gives out awards in various categories every year. And Amanda was voted our Kansas Children's Champion and so deserving of that award. And so I had the pleasure of getting to tell her that last week. And of course, this like virtual weird world that we're living in, we haven't had a big celebration yet, but congratulations, Amanda, and thank you for everything that you do for early childhood across Kansas.
I'm not crying today. I did cry last week, Friday. Thank you, Jennifer. I am totally humbled and honored and very embarrassed too. So it's a real, yeah. Crystal, go ahead.
Yeah, I just was going to share my program is in Wyandotte County. We partner with now 15 private childcare centers. And I was looking at data from, January, February 2020, and now in terms of enrollment. And with the exception of maybe 2 of our partners, all of our partners are now back to their pre-pandemic enrollment. And it was just really encouraging to me. And meaning they also had teachers in those classrooms as well. So just wanted to share here.
Thanks, Crystal. That's awesome. Any other bright spots to share today? All right. Well, enjoy the rest of your app. Oh, go ahead.
I was just going to say tomorrow is the Mad Hatter conference put on by Casito, and I am so excited to go. I'm headed in and just cannot wait. So just wanted to say thank you to Casito to getting this going. The conference season has begun.
That is awesome. Thank you, Emily. And I'll also highlight, I don't know who else was at the Kansas Division for Early Childhood Conference a couple of weeks ago in Wichita, but just being able to see people face to face in 3D just felt amazing. So yeah, thanks to everybody who took the leap and decided to hold an in-person event and stay the course, and kudos and good luck. And yeah, here's to future connections. So that said, all of the upcoming meetings listed here on the slide will be held via Zoom for the time being, but there are upcoming meetings coming up. The Kansas Children's Cabinet and Trust Fund will meet on Friday, April 1st. We'll present recommendations that we discussed here to them at that meeting. And then early childhood stakeholders will meet in the afternoon. As a reminder, folks can watch the Children's Cabinet meeting on the Children's Cabinet YouTube page. And if people are interested in joining the early childhood stakeholders group, which is open to any early childhood stakeholder in the state of Kansas who would like to be a part of the work to move our All In for Kansas Kids strategic plan forward, they're welcome to do so. There's not a commitment that they have to attend all meetings of this group, and folks can email Debbie Deere, DDEERE at ksde.org if they'd like to get connected with that. And then all of us will meet next on Friday, April 15th for our next early childhood recommendations panel meeting. I'll highlight for everybody. I appreciate that is Good Friday. I know that I'll be leaving Topeka at 11:15 to make it back to Lawrence. So we will stay tuned for what the agenda for that meeting looks like, but we will see you all soon. Take good care. And have a great spring break too.